we can all agree that really the treatment options and how we care for individuals with SMA has very dramatically shifted just over the past decade, or even less than that, even in recent years. And these changes have culminated from both new treatments becoming available, now with 3 FDA-approved disease-modifying and SMN-dependent treatments for SMA. In the pediatric space, we also have the rolling out across the country in the United States of newborn screening. And fortunately, as of 2024, we have now all states in the United States covering SMA on their newborn screening platforms. And so this has really led to, over recent years, a change in how new individuals with SMA are coming to our practices, but also whether it's a newly diagnosed baby, whether it's a family potentially expecting a baby with SMA, or even individuals coming to us with who are older with newly diagnosed or even with a known diagnosis. The landscape has changed with new therapies. And so a big part of this group that was brought together for this update in the consensus documents was to think about how these new changes in how individuals are coming to us, including in the potentially pre-symptomatic or very early symptomatic state, and with new therapies, how we as a community think about those discussions with families, with patients, and how we also continue to keep to a core of multidisciplinary care when thinking about the potential outcomes or potential healthcare issues that we may still potentially need to monitor. Well, how about you, Bakri?
Yeah, I totally agree, and I think you really brought the major point. And so the last time we've had best practices recommendation for diagnosis and treatment, that was back in 2018. And since then, as of now, as you stated, there are several disease-modifying therapies, and not only the disease-modifying therapies, but we learn as we go. There is a growing real-world experience with these SMN enhancing treatment as they made it to the clinic. And so this exercise in terms of bringing the recommendation actually was done in a very unique way. Not only it started by a systematic literature review of all what's out there on SMN enhancing treatment, but also added a consensus process involving American and European healthcare provider. In addition, to the patient and caregiver perspectives, which made it really unique and much needed work.